in training.
Okay.
But of course, like I said, our niche is health.
Yes.
So where we're going to start and what we're going to concentrate on is health. Then everything else that complements health is what we're going to be adding a little bit later.
Okay, okay, I hear you. You mentioned nursing.
Yes.
Every time we have a conversation with Outspan, we get so many questions on nursing. Nataka kufanya nursing. What can I do to do nursing? So does that mean you'll also be training degree level of nursing?
Yes.
Nursing students?
Yes.
That
Degree in clinical medicine,
Yeah.
degree in nursing,
Yeah.
and degree in counseling psychology.
Okay.
Yes.
Okay.
Yes.
Now let's dive down to mental health. Now the topic we are looking at today is bridging the mental health gap. This is a conversation that we've had again and again, and you always say that you can't talk about mental health enough.
Yes.
You really can't talk about mental health enough, and so we need to bring in people, as many as we can, to speak about mental health and to just bridge the gap on mental health. Harrison, as you've said, is that you joined Outspan in 2019.
2019, yeah.
So you've been there.
Yeah.
And you are in the medical field. Mental health is such a big topic and a big issue in the the health sector. Which gap is this? Which gap are we talking about? Well, you say that we're bridging the gap of mental health.
Okay. We are bridging the gap. The gap, firstly, the gap that's there is that there is a surge in mental health related, let's say, a crisis or issues, and we are not having enough professionals or maybe qualified and actually ethical professionals to really come forward and maybe try to meet this need or this demand that is there to address this crisis or these issues we are having with mental health. Talk of depression, anxiety, you've talked of autism. How do we support these parents who are living with such children? PTSD. We are seeing even day-to-day stressors, and which can give maybe daily stress or maybe stress that could accumulate to become something else like a mental health illness. So we are trying to bridge that gap by raising enough, training enough professionals who are equipped with the skills, with the knowledge, and now the practical experience to really address these challenges and these issues, so that when you meet someone out there and is a, let's say, a psychologist, that person is enough to maybe be of help to you, and you're not looking like you're going to see that person and then having to refer to someone bigger or someone maybe more skilled. So the gap also is intensive training and intensive installation of the skills through the practical experience.
I actually love that you're speaking about that. I think we should get to a place where we all understand what you should do. Ukipatana na mtu mwenye ako na depression. It has to get to a place where we all understand what depression is, the mental health issues that are happening, and just to be able to, handle them, know who you can refer them to, but also more like I see it as a first aid. If I'm talking about depression, at least what can I do? As I refer them to someone who's a professional. Not that you are a clinical psychologist. What's the rates of mental health issues in Kenya currently?
Quite high.
Yeah.
I just saw recently there were released statistics on mental health, and not specifically, but the main issues that we're having currently is mental health, but pale juu sana it's depression, PTSD, anxiety disorders, and all that. Everything that revolves around health, mental health will be in the mix. And even for yourself to know that you're okay, even physically, or maybe to take yourself even to a facility to check in a facility for treatment, you need to be in the right mental space to do this. For you to thrive, for you to be able to be a better journalist, for you to be able to be a better manager, for you to work, you need to be in the right mental space.
Yeah.
So if we are seeing gaps in our workplaces, in our stations of work, if we are seeing people who are struggling to do their usual jobs, like what they are used to do now, they are not doing it with such efficiency.
Yeah.
We are looking at probably a mental health issue or such like a gap that needs to be addressed.
Yeah. Okay. And also now we have psychology as one of the pioneer degree courses that you're offering.
Yes.
And I think that is very beautiful. But then for the record, I tried doing psychology and it went south. Yeah, we'll need to do that again.
Okay.
Just put it out there. If there's anyone who contributed to that and you're watching, we'll talk about that. I think that's a very one of the top courses that people should do.
Yes.
But from your perspective, why is it one of the pioneer, degree courses that you're offering at Outspan?
First of all, I'm very grateful to Outspan for recognizing from day one of the starting of the college that we needed, alongside all the medical courses we were starting in 2009, we needed to start psychology. So psychology has never been by the way for Outspan. It's never been an aside. And at the same time that we started the diploma in clinical counseling psychology, we also started the department of psychology at the hospital. So it's alongside. So the department of psychology and the training program has grown at the same time alongside. And that is because even back then in 2009, it was recognized that you really can no longer afford to do healthcare without mental health. It's just not possible. The link between the mind and the body is there. So it's not something that is a byproduct of illness. Neither is it something that is separate from the physical illnesses. Even someone who's suffering from depression, from mental illness, is going to have there are going to be physical indicators to it. Or even when they come to the hospital, they will come for the physical aspects of it, but the root cause is actually mental illness. On the other side, we right now where healthcare is, even where it was in 2009, it's about prevention. When we are talking about non-communicable diseases, of which Mount Kenya region is actually leading with diabetes and hypertension, we can't talk about non-communicable diseases without talking about behavior change. This is someone who has to think about their nutrition, they have to think about their exercise, they have to think about lifestyle factors alongside the medication. And this is true for every illness, because this is someone, the hospital environment is to stabilize you, but the majority of your improvement is going to happen at home. So this person is responsible for taking those medications and for doing everything else that supports that medication working. And that requires someone who is able to make good decisions, problem solve, critically think about what they're doing, and even plan for these things. Because again, when we're talking about behaviors, we're talking about consistent behaviors. These are also not things that you just do in one day and then all of a sudden umepona na uko sawa. These are behaviors that must be part of your day-to-day life. That requires commitment, and commitment requires that, I sit down and think about it and actually incorporate and internalize and decide that this is what I want for myself, and this is good for me. So mental health, I know people think about mental health only about the mental illnesses, but mental health is so wide, just like physical health is so wide. There are people who are having problems with their health who are not in the hospital. Not everybody who is struggling with their health actually ends up in the hospital. There are a lot more people in the community who need to do a lot more to improve their health than the ones in the hospital. Mental health is similar in that way. By the time you come to the hospital for a mental health issue, it's already at critical critical, because the hospital environment also is not, we all know what the hospital environment is like. So by the time you're coming there, you're actually at a critical stage when it comes to mental illness. So a lot more mental health issues are out in the community. So why psychology has to be alongside? Because of all those things. We talk about healthcare is about behavior change. Even that person who's taking medicine, it's behavior change. Yes, and so we come in to help in that area. So when it comes to healthcare, it requires a team effort. The doctor cannot do the job by himself. He'll need the nurse, he'll need the lab, he'll need all those other cadres that are there. And mental health is one of them. So this patient is not an organ. This is a human being, is a person that has a mind and has a body. And therefore all these professionals, we need to, in our areas of expertise, is to help this patient to be whole, to be way better than when they came in. So it's not just about fixing a problem, but it's about living a full, productive life.
I love that.
Yes.
I love that. There's something that was posted by WHO, and they said that wellness is not the absence of a sickness.
Yes.
Something close to that. That wellness is to be not the absence of a sickness or a health condition or a disease, is for you to be whole.
Yes.
Mentally, physically, spiritually, socially.
Yes.
It's for you to be well. No, that is wellness.
Yes.
So, as you said, when we speak about wellness, we're not only speaking about this is a condition that a doctor will sort.
Yes.
We're speaking about you have to be well. By the time you're leaving the hospital, uko sawa.
Yes.
Mentally, you're okay. You can go out and socialize and actually be of impact to the society.
Yes.
You actually mentioned some of the conditions under mental health. You talked about PTSD, you talked about anxiety, what you talked about earlier, autism. But maybe, not to digress, but maybe just to give some of the very early signs to show that you could be mentally ill.
Okay.
What would that look like?
Very, very simple. When something is interfering, when you're not able to do your day-to-day functioning, the simplest way to know that something is happening with your mental health is look at your day-to-day functioning. When you wake up in the morning, you have a routine. You wake up, maybe you read the Bible, you meditate, you shower, you think about what you're going to wear, you even think about what it looks like and how you're going to present yourself to the world. You may think about what you're going to eat for breakfast, and then you go to work, and there's a process of going to work, get out of the house, and you have organized your transport, whatever that may be, get to work, and even at work there's a way that you start your work. That's just basic routine. When you find you're not doing any of those things, that is your mental health that is starting to be interfered with. When you find you don't want to wake up, you don't want to get out of the bed, you don't care about what you look like and how you present yourself to the world, you're struggling to even plan. When you think about what do I want for breakfast, and you're struggling to even think about should I eat, should I not eat, I don't feel like eating, or you're even just eating whatever is there, you're not really caring what you're putting in your body. You get out of the house and you're feeling overwhelmed. Let me use the word overwhelmed, even how to get to work, how to even start your day. Those are all signs. So it doesn't have to reach the place where you have lost a lot of weight, you're totally exhausted and totally in burnout. Just an interference in your day-to-day routine, you need to start thinking about, okay, what's happening in my mind, what's happening in my environment that is making it difficult for me to engage in my day-to-day routine.
Okay, so the simple things. And people really ignore that. I just think, oh, nimechoka by the way. It's just me getting tired. It's me, I'm not getting bored with the norm. But as you've said, that could actually mean that your mental health is being interfered with. And so you need to you need to check that and do something about it.
Yes, I always recommend that someone should take at least 5 minutes, even if it's 5 minutes every day, checking in with yourself.
Yeah.
You know, how am I feeling? Am I okay? How was my day? What did I like about my day? What did I not like? You know, what's my life like right now? And, you know, how am I feeling about it? What am I thinking about it? Every day. Yeah. So you don't wait until you're having you're really smelling to shower. We shower every day. Yeah. You know, this maintain whether you're filthy, whether you're 100% dirty or you're not, you shower every day. It's maintenance. So mental health is the same. It's something that you need to do every single day, is to check in with yourself and say, you know, how am I feeling? What am I thinking? You know, what do I like about my life? What do I not like about it? What am I, you know, what are my goals? And, you know, am I feeling like I'm heading somewhere? Am I feeling I'm behind? You know, the people around me, are they really supportive? Am I just hanging on because they've been there? You know, those questions on a day-to-day basis. Then now you begin to start noticing when things are not okay. Because it's about self-awareness. So you start now noticing that, okay, I'm actually not okay. I may still be functioning, I may still be going to work, but I'm not doing it at the level that I want to do it at. But it's when you make that commitment to spend time with yourself and check in with yourself that you now start taking notice when things are not okay. Yes. Okay. This also happens with physical. You know, we've had cases of people getting surprised when, you know, someone just drops, you know, and then they had high blood pressure. But if they were checking with their body speaks. The body does speak. So, and it will tell you in very maybe subtle ways that things are not okay. That exhaustion that is a little bit more than what you normally is actually your body communicating that or you walk up the stairs, you're so breathless and you used to go up them a little bit more. Those are too small two signs are telling you, can I go for a physical checkup and check whether things are okay? Because again, we are in the era of preventable diseases. Yes.
So prevent.
Oh,
I love that. Okay. So if you're just joining us, today we are talking about bridging the mental health gap, and we're here with Outspan Global University. And we've been saying on our screen is that Outspan Global University is a state-of-the-art university, a university that you'd get, especially for the people who are very interested with the health courses. They have really specialized with the health courses, and you go there, you get literally everything that you need. As we speak about health courses, we speak about you being practical. How you do theory, you're able to, you know, get to the practical bit of everything. And the beauty about it is that there's a hospital. In fact, it's the hospital that birthed the college, now university. So there's a hospital that you'd go, do your practicals there, learn everything that you'll get to, you know, now experience in the Transemanga kwa grounds. Hapo ndo utaland vitu zenye utaenda ku experience kwa ground. And so Outspan is really the university of choice. For the people who are listening now and they're just hearing Outspan today, they're thinking, why choose Outspan and not any other place? So why choose Outspan and not any other university?
Okay. First of all is our track record. We've been training in psychology from 2009. So this is something we know what it takes to be a psychologist working in the healthcare space, you know, because that is what our niche is. And so because we've been doing this from 2009, that's 16 years, we know exactly what is required for a psychologist to be able to work comfortably in a hospital environment, because that's our area. The other thing why you should choose Outspan, and especially to do the degree in counseling psychology at Outspan, because our degree is going to be different. For example, one of the things is that we didn't want to lose is that aspect of the hospital. So incorporated in the courses that the students will be taking will be units that will help them to be able to work in a hospital setting. So they're clinical, we call them clinical units, that they'll be able to do. that is part of the day, is part of the degree. The other thing that is different about our degree is that whereas other degrees wait until the very end for the student to go for attachment, our students will be going for attachment every single year.
Oh wow!
So at the end of first year, the last semester of the year, they're in attachment. Second year the same, third year the same, and then the final year.
Okay.
Also, our degree has incorporated AI, so we will be doing some units that are AI in healthcare. Tele counseling will be also, because now in the world, being global does not mean that you physically have to go to another country to be able to do your work. So we'll be training in how to do virtual counseling that will expand and the area of reach for our students once they graduate. So we've incorporated technology as well in our degree from day one. You know, this is now from inception, so this is not something that is a by the way. So the other aspect of all this is because of the ecosystem that Outspan has. We are not just Outspan in Nyeri anymore. We have a hospital in Nanyuki, we have a hospital in Embu, we have Outspan Serenity Center, that's a mental health center. This is a center that not only does rehabilitation of alcohol and drugs, but also takes care of mental health. And then of course we have our mother hospital in Nyeri. So that ecosystem gives us a lot of reach in terms of being able to place our students. So, and every single part of this is also having a psychology department. So Embu, Nanyuki, they're also again intentionally incorporating mental health. But above and beyond that, we have agreements with Laikipia County, we have agreements with the county government of Nyeri that allows us to work in any health center in either of those counties. And there are others that we're going to be signing very soon. So our students are going to be exposed, not just to private, because that might be the other question is, okay, you're a private hospital, what about public? But we have agreements. Remember, we've been placing students at diploma level in all these places. We've been working with schools, we've been working with health centers, with the public hospital. So this is something we've been doing. So that's something we are going to continue. So by the time our student has graduated, they have been exposed to private, to public, to the ideal, which is us, you know, because we've been having the psychology department from 2009, so they will know what it needs to look like, but we'll also be preparing them to be able to set up the same wherever they go, because they have seen what it takes to have a department of psychology with us. So it doesn't mean that now when they go to a hospital that doesn't have, that they don't know what to do.
They can set up that.
Oh yes, yes. One of the things, and we are very intentional about this, is that we also prepare our students to create their job. Now, you had mentioned earlier about people being interested in, you know, which course do I take that will allow me not to tarmac, okay? In today's world, it's actually about creating the job that you want. I think you've heard about the challenges of what employers have been encountering, especially with Gen Z, and saying, you know, Gen Z are coming in and saying, no, this is actually not acceptable. Things that boomers and Gen X's have accepted for years, and Gen Z are coming and challenging that. Now, the strength of that generation is they know what it takes to be able to do that job. They know what is right, what is wrong, what should not happen in a job place. And that's why there's that kuna hiyo ka vurutano, but actually I see it as a strength, because they're saying they're demanding more, and they're demanding what is actually supposed to be happening, and saying you guys are not even supposed to have been putting up with this. So what we do as Outspan is we actually prepare our students to be able to create that job and the job that they want. So when they're able to identify the gap in that facility and say, this is how things are supposed to be done. So they create that awareness, they go there and create that awareness. We're not afraid of that. We're not afraid that people don't know what mental illness. We face it head on. So they can go to a hospital that has no clue or no idea or has never even thought that they can have mental health as a department, and they go and they literally create their job and they create their department.
I think that's really beautiful. As you said, is that we're now at a place where we need to know how to create our jobs. Wherever you are, know what to do. And that also means that the students are very practical. Theory too. They're very, very practical. And when we take an example from you, you've now been there for, is it 7 years? From 2019? Yes, 7 years. What was your experience as a student at Outspan?
It was really awesome. I wouldn't be anything I am right now if maybe I say it's like a force that pulled me towards that. And right from that became my turning point. And that has been a story, has been awesome. I would say I didn't bring my own table like she has taught us to. When we go to those workstations and bring your own table. But my colleagues, my classmates, they have had this training. They have gone out there and they have made impact. They have brought their own tables and created even opportunities for more professionals in the Department of Mental Health. But my experience in Outspan Medical College then was nothing short of awesome, as I had said. The training and then the being followed. Harrison, where are you? Harrison, I have not seen you in class.
Oh, really?
I was engaging in some other activities, so I would come to class when I want to, or maybe when there's a class. Let's say when there's a class.
Students.
Yes, but you see the whole, you don't just come to class, there's the whole mentorship, there's other activities that you're supposed to engage in. The CSR activities, the health promotional activities, prevention, advocacy, and everything. So it's not just class. So by that time, my tutors were able to recognize that this person and any other student, and that's what they do. It's not just about coming to class, because everyone at the end of the day will graduate. But how do we make an impact that when you go out there, you are an Outspanian? When you go to any facility, you'll meet maybe an alumni of our institution. So how is it possible that when you graduate from Outspan, you're going to get a job? Everyone will have a degree, a diploma in something. But what is that added advantage that you'll have? And that is what I feel beyond the training, now the curriculum, what they go out of their way is to make sure that this person becomes an actual professional and someone who can who is maybe disciplined and someone who can self-supervise themselves. Something like that.
I think that's very important to make sure that your character is also online.
Yes.
It's not just about you're a doctor, have a degree, a diploma, and that's fine.
That's also something that is different about Outspan Global University, is that we really care about the character of the person. You know, it's not just about attending class. In fact, you know, a lot of the technical knowledge, you can get it, you know, in this day and age of digital exposure that people have. You can go on YouTube, you can go online, and you can get books on psychology and all this, and literally teach yourself. So why are you coming to class? You know, what is it that is beyond now the teacher and the student interaction, but who is this person? You know, who is this person that we are preparing for the job market? What kind of person are we preparing, you know, for the job market? So like Harrison was saying, we follow you. You know, we want to know what is happening. You miss class, we want to know what is going on. You have a case, kuna kesi mahali. I know sometimes students do complain that we follow them so much, but at the end of it, they come to realize, they come back and thank us because you know, your reputation is all that you have, you know, literally. What is it? How many nurses and medical healthcare professionals are graduating every single day? I mean, we can't even compete with MTC, which has 10,000, you know, facilities, and they're graduating all the time. But why should you pick someone who has graduated with a degree from Outspan Global University? Okay, it's who that person is. You know, nowadays employers are looking at attitude and they're looking at soft skills. You know, because technical they can teach you, but they're looking at attitude especially and the soft skills. And so even the type of training that we do, I know you had mentioned something on practical. Our classes, the in-class training is also CBE, the competency-based is incorporated. So it's not just theory. Outspan Global University, we have a skills lab that is psychology with a two-way mirror. So part of we teach in class, and then they go and they do role plays and they practice in our skills lab. So by the time they're even going for attachment, they've had the hands-on practical aspect of it, so they feel comfortable being in the workplace. But you see, the place that you're attaching them to wants them to come on time. You know, wants them to be dressed well, want them to be able to speak up and to be able to communicate. And so those are also things that we incorporate. So even in class, they do presentations, they do case studies and things like that. That's all part of the kind of training that we do.
Oh wow.
And also now, like, what we benefit even most is any other professional would benefit most is personal development. Personal development, because that helps you to be a better journalist, to be a better clinician, to be a better psychologist. And maybe there are parents out there who are wondering, because in this wake of Gen Z, how do I tame my boy, how do I tame my girl? Ataenda shule, ataenda hiyo campus, but how am I convinced even after the 4 years this person will be of anything, not just go to school and graduate? This is a sign, this is the moment that it comes in handy because of this issue parents are having with the parenting and raising such kids like Gen Z. So because in the personal development training, in the following, in the mentorship, this person ni kama ameenda kambia si ya jeshi lakini kambi yenye besides kusoma atakuwa somebody different.
And I would tend to think that is again directly related to your mental health. Because if you can't relate well with people, if you don't have the right character, then it means at some point utakuwa sidelined, at some point it gets repression, at some point, you know. So we tend to think that means mnaanza na your students to make sure that their mental health equals down, and then now translates to, you know, the facilities that
there's an office for that. There is counselors in the institution, in the university, and also by extension our clinics in the hospital that is open for students.
Interesting. I love that. Now for the people who are watching us today and they would like to join, maybe take us through the courses that you have once again. Just to remind you is that today in studio we are having the Outspan Global University. Now, for the people who would like to join, take us through the courses that you're having.
Okay, so Outspan Global University is beginning with 3 degree courses, a degree in clinical medicine, degree in nursing, and degree in counseling psychology. All of them, the requirements are C+. For clinical medicine and for nursing, they are cluster subjects as usual. They're cluster subjects that they have to meet. For psychology, no cluster subjects. So another advantage is we just look at the overall grade, C+. So as long as you have a C+, regardless of what you scored in the individual subjects, you qualify to do a degree in counseling psychology. And of course, it's because, you know, high school, there's not really a unit on psychology, so we'll start you from zero. Yes, and we'll build the foundation from that. So we don't really need cluster subjects because we're also going to train you on what it means to be a counselor and what it means to be a psychologist and what are the skills that are needed for that. So we'll train you on that. I think our numbers on the screen, there are 3 main numbers. So when they call and you qualify, you can even send your result slip even via WhatsApp to those numbers, and someone will get in touch with you and will be able to let you know whether you've actually qualified for any of those degrees. Our intake date is on May 5th. Okay? So that is when we are admitting. Like I said, we received our letter of interim authority on March 1st and March 11th, and we were ready. In fact, we were just waiting for it. We are ready, so we are ready.
I see we have someone who's asking about for someone who's had a diploma and they'd like to do a degree on the same course. How does that go?
Oh, that's also very, very possible. That's upgrading. So however, that program will be next year because we need to submit it to the Commission of University of Education, get approval, and then that. And remember also, we are starting with first year. So someone who has done a diploma will not need the first year units because they already have them. So lazima tufike second year hapo mwisho ndio sasa aweze kuingia vizuri. So remember, we are beginning, so we can't start upgrading right now. So if they're just patient a little bit, next year they'll be able to apply and come in and upgrade to degree. Yes.
All right. Now, we'll be sharing our numbers on the screen, the Outspan numbers on the screen in a few minutes. So if you'd like to join, you can always call the numbers, as Madam Kadia said, and you'll be able to get the feedback that you need. For someone who's watching and they'd like to join, from your experience as a student and now a clinical psychologist at Outspan Medical Hospital, what would you tell them?
And don't wait too long, because also the time factor. If you are interested, this is the time, and this is what prepares you to be better. Not better as a psychologist, not better as a clinician, but better as a person, and then as a professional.
Okay. So wasingoje? Join
sahi
immediately
na mapema, because hatuanzi ati from zero. You're just building up from 16 years legacy. So it's not like you can wait and see how it goes after 4 years or probably when we have charter or anything. We are building from a legacy that has been there for 16 years, that has produced professionals. Go to any facility around Kenya, you'll meet an in charge who is an alumni of our institution. You'll meet a very beautiful and a team player, professional from Outspan. So if you go to any facility, ask, are you from Outspan? If you get good services from a clinician, did you study in Outspan? But that's besides. So
the point, All right. Yeah, that's great. Now, for the people who are watching, and I know that we've already been giving you our numbers, so you can start calling and sending in your questions already, and you'll get feedback. Now, for the people watching and they'd like to join, what would be your words to them from the HOD?
Welcome. For those who are listening and would like to join us, I would say karibuni sana. Remember, we have a track record. We have a 16-year track record of doing this, especially, yes, it's a very, very long time, and especially for mental health. I have been there from 2009 when it was just buildings, creating this program and going through all the steps that are required to be able to have psychologists work alongside doctors and nurses. So remember that you're coming into an institution that has a track record. That's one. Number two, I would say that as this is a hospital that is intentional about mental health. It's not a byproduct. It's not because of the recent wave, like in your trend. It's not because that now it's trendy to have a therapist, and so now here we are having a degree. We have known about mental health for 16 years, and we've been doing this for 16 years, even when no one thought about it. Everyone was afraid of it. This is something that we believed in. So it's not a trend, it is something that we have known. So we have been intentional about mental health in healthcare for 16 years. So I want people to remember that they're coming to a very established facility, even as much as the university is new, but we have the groundwork. We have a 16-year history of doing this and filling this space of mental health. The third thing, and most important that I want them to remember is that like Harrison has said, our graduates are different because of that intention. Even the Bible says that there's nothing by mistake. You need to plan. You need to be intentional about your life and even about your walk with God. And so because of that intention and because of that track record, a graduate from Outspan is different, especially a psychologist from Outspan, and we get this feedback all the time from health facilities. We just finished assessments of our third years who are in their final attachment, and when I was looking at the reports that I was getting, they're all saying, Outspan, wanajua kazi, they know, they come in, they know what to do. They're not intimidated by the hospital, they're not intimidated by the professionals who are there. They stand toe to toe with doctors and nurses to do that work, and their voice is heard. They also remind the healthcare professionals that, let's take care of their mental health. So that is the difference. That is what is going to be different when you come and train with us. You'll be able to enter a hospital with a full confidence. Unaenda hiyo ward round na unaongea story ya mental health care. You're not even intimidated ati kuna daktari hapo siwezi ongea. So remember that.
I love that. Now this is your sign for you to join Outspan. If you've been thinking around it and you've been planning to join a university for a health course that we've talked about, now this is the right place. All right, thank you. That has been great. And you've shared the numbers, so reach out, and I know that you'll get the help that you need. Once again, that has been such a wholesome conversation.
Thank you.
Thank you for sharing your experience.
Thank you.
No, we know that it's truly the right place to be. And that's such a great, huge step from a college to a university. Oh, that's great. That's great. Salimia sana watu wa Nyeri. Yes, and send our gratitude to them.
All right.
I see we have Prudence. Karibu sana. I see you have Prudence. Anasema shago na vigelegele hapa kweli kweli. Anasema Outspan is the best place to have been.
Wow.
Yes, and Prudence Ruth Kirathimo. I'm sure she's an alumni from Outspan.
Wow.
Yeah.
Thank you. Thank you, Prudence.
Thank you, Prudence. You want to say something?
I wanted to say thank you so much for having us, for being our partner, always open to us, coming as many times as you want. It's really been fruitful, and I just look forward to continuing that as we transition to the university.
Sure thing.
Thanks.
All right, that's said and done. It has been such an amazing conversation. I do believe in my heart that you've gotten something from the conversation that we've had about mental health, which is very critical. As you said, is that in the time that we are living in, mental health is not something that we'd just assume and say that it's not here with us. It is truly here with us, and so we have to actually talk about it. We have to make sure that we know what mental health is and what to do. And Outspan Global University is bridging the gap. So now you know what to do. All right? That has been great. Once again, asanteni sana. God bless you.
God bless you. Thank you. God bless you too.
Amen. And thank you so much for tuning in. Our conversation today has been bridging the gap on issues mental health. And we've had this conversation with Outspan Global University. All right? Now we take a look at the Did You Know segment. This is a segment that after a long discussion, beautiful, amazing discussion that we've had, we get to just jog our minds a little bit and see if we can, just get to learn something. And on our Did You Know segment today is that, did you know that some turtles can live without breathing for months? Interesting, yeah?
Yes, I did know that.
Yeah.
Wow.
That there are turtles who can actually live for months without breathing. That's very interesting. Yeah, I think God is such a creator.
Yes.
Very, for lack of a better word, a creative creator.
Yes. Very artistic.
Very artistic.
Yeah.
Because how would you live for months without breathing? Let alone months. Even 1 hour without breathing.
Yeah.
A turtle can, apparently.
Apparently a turtle can. Yeah. So that is what we get to learn from today's Did You Know segment. And on some of the conferences that we are having is a conference that it is ongoing already, and that is the Teens Prayer Conference of April. Started on the 13th. And is going on till the 17th of April, daily from 8 a.m. to 5 p.m. at the Faith Chapel. The theme for this year is Relentless Pursuits of God's Presence. Such an amazing place to be. We always say that it's very beautiful to be in the presence of God, and it has been hosted by Kingdom Seekers Teens Fellowship, Nakuru. These are young people that are sought out for Christ. Completely, and it's very beautiful to see. So if you're a teen and you're out there, please make sure that you join. It's ongoing already. We'll be having Apostle John Kimani William and Reverend Naomi Kimani. We'll be having Pastor Julia Karanja. We'll be having Pastor Jim Mwando. So come join and let's have a good time in the presence of God. And after that, we'll be having the youths coming together, and that is the Carriers of Glory Youth Conference that has been organized by Kingdom Seekers Fellowship Youth Nakuru. And of course, as we always say, is that it's a time of basking in the presence of God. And so the theme of this year will be unlocking and maximizing potential. Unlocking and then maximizing potential. It's free of charge for the boarders, so come and bask in the presence of God. It will be starting on the 27th of April to the 2nd of May 2026, so plan accordingly and come be with us. We'll be having Apostle John Kimani William, as you can see on your screen. We'll be having Reverend Naomi Kimani. We'll be having Benihin Walubengo. Yes. We'll be having many people, guest worshippers. You very well know them. Carol and Frida will be there. We'll be having Sheila Juma as a guest worshipper as well. An amazing team. A father of the land will be having Bishop Jim Mwando. We'll be having Mr. Patrick Kigunda. We'll be having Dr. Daniel, so do not miss out. We'll be having Prophetess Winnie as well. We'll be having Reverend Esolom Karanja as well. So do not miss out. If you're a young people out there, plan accordingly. And from the 27th of April to the 2nd of May, come and join us for the Carriers of Glory Youth Conference. All right? Perfect. I can't wait to see you then. Plan accordingly and see you from the 27th of April. Kama wewe ni teenager, already the conference is ongoing. So make your way to Kingdom Seekers Fellowship. The conference is happening at the Faith Chapel. So Kudra and let us just fellowship together. God bless you. Do have an amazing rest of the week. Today is Wednesday, and so on this particular show, we'll see you, God willing, next week, same time, same place. Until then, God bless you. Do have an amazing rest of the day and rest of the week. My name is Rachel Kahugu. Bye-bye.